Interventional oncology is one of the most exciting subspecialties in interventional radiology, which has seen an explosion over the last 2 decades with a lot of growth. And as with anything else, growth brings about challenges. And the focus of the talk is about some of the real challenges that we face with relationship to practice building, data, studies, and day-to-day challenges in creating a robust interventional oncology practice and how to move the science forward. I think one of the most important things is to have those physician innovators who break the ceiling and look out for new frontiers and new applications for the technologies that we currently have, or for newer technologies that are yet to make it. And once we have that, then the science follows, and then we do have a possibility of finding ourselves within the practice guidelines. If Dr. Daughter had not taken a chance performing the first angioplasty, the first TACE procedure performed by Professor Yamada in Japan, first ablation by Professor Solbiati from Italy, and most recently the first ablation for glioblastoma multiforme in France by Professor Ganji. So these are all examples of physicians who have pushed the boundaries, pushed the limits to see what more we can accomplish in areas which were not seen before. While we are familiar with some of the challenges and the potential solutions, one of the key ingredients that is necessary for creating a successful interventional oncology practice is a physician champion or a few physician champions who are willing to sacrifice a lot of their personal time for the cause. And without that, I don't think it would be possible to come up with a practice model. And to also understand that interventional oncology is not a procedure, it's a subspecialty by itself now. So you cannot do this on the side or do it as a procedure. It requires your time and commitment in multidisciplinary tumor boards, performing the procedures, follow-up, seeing patients in clinic, rounding on them. So all this ties up into a robust interventional oncology practice. What I know now, which I wish I had known 13 years ago, is the fact that this is a marathon and not a sprint. And you need a lot of time and perseverance. Change happens slowly, but you have to stay the course. And once you produce good results, the data follows and more innovation takes place. And eventually we will find ourselves in the guidelines. And also the fact that this is a team sport. Interventional oncology is something that you have to collaborate with other specialties. And as difficult as it might be in the beginning, that is the sustained path for us to establish ourselves.